Hello, and thank you for joining us for this webinar, You Can't Fix Your Mental Health with Duct Tape, Suicide Prevention in the Construction Field. We are privileged to have three individuals from the construction industry sharing their lived experiences, personal and workplace suicide prevention efforts, and working with us to outreach to their network and communities. This webinar will discuss how online screening programs, such as the one available on healthymenmichigan.org, can be an upstream strategy that can help get out in front of problems to prevent suicide among the population of men working in the construction industry. The Healthy Men Michigan campaign offers free online mental health screenings, mental health educational information, and mental health resources for men throughout Michigan. HealthyMenMichigan.org is open to anyone, but specifically designed to appeal to men and their loved ones. It will also provide comprehensive local, statewide, and national mental health, substance use, and crisis resources. The campaign is part of a larger research effort to evaluate innovative online programs to see what actually works for men to reduce suicidal thoughts and behaviors. This research is supported by the cooperative agreement number shown here, funded by the Centers for Disease Control and Prevention. Our panelists today are Cal Beyer, Director of Risk Management at Lakeside Industries, David James, Chief Financial Officer of FNF Construction, Dr. Jody Jacobson Fry, Associate Professor at University of Maryland, Baltimore School of Social Work, myself, Jill Fontaine, Program Manager at Screening for Mental Health, and Bob Vanpool, Executive Director of Pine Rest Christian Mental Health Services Employee Assistance Program. Our panelists today will share lived experiences, discuss how screening and data collection can help prevent suicide, provide an overview of the research study, and describe the Healthy Men Michigan campaign. We have a full agenda, so we will not be able to take many questions. Please do still send us your questions through our survey that we will be sending out at the end of the webinar, and if we are not able to get to your questions during the presentation, we will be sure to respond to them in a follow-up email. I am honored to introduce Cal Beyer. Cal is the Director of Risk Management at Lakeside Industries in Issaquah, Washington. He has 30 years of experience in serving the construction industry in various capacities and has worked with over 250 contractors on strategic risk improvement and risk management best practices. Cal is active in the Construction Financial Management Association and served as National Secretary for 2009 to 2010. He speaks regularly at CFMA's annual conference and exhibition and has 17 authored and co-authored articles since 2006 for CFMA's Building Profits. Cal has served on the Workplace Task Force of the National Action Alliance for Suicide Prevention since inception in 2010. He was appointed as co-lead of this task force in 2015 and to the Executive Committee in 2016. He spoke at the pre-meeting of the White House Conference on Men's Health in January 2016 to the Department of Health and Human Services on the construction industry initiative he is leading on mental health and suicide prevention. Cal.
Jill, thank you very much for that great introduction. It's a pleasure to be joined today by two dear longtime friends, Dave James and Bob Vander Pol. It was Bob who taught me suicide prevention strategies in the workplace starting back in 2006. And it was Bob who nominated me to serve on the Workplace Task Force of the National Action Alliance when it was formed in 2010. Bob was the co-chair and I became the co-chair in 2016. Thanks to the efforts of the Construction Financial Management Association and Dr. Sally Spencer Thomas, I was appointed to the Executive Committee in 2016, and it's through my work with the Action Alliance that I met Dr. Jody Jacobson Fry and also Screening for Mental Health. Very impressed with these initiatives. It was David James who was the first friend to offer me help in this initiative, and I'm really proud of how we're recruiting others in this life-saving mission. Why this topic? Mental health and suicide prevention is a very important topic in the construction industry. Nationally, it's a pressing public health concern. In 2015, there were over 43,000 deaths to suicide. And if you think about motor vehicle accidents taking the lives of approximately 32,000, homicides between 16 and 19,000, depending on year, suicides are frequently underreported. It's kind of silent. There's been a taboo. There's been a culture of not talking about this topic. We are talking about it because construction is a high-risk industry. There are industry risk factors and demographic risk factors that over the past 15 years have made this a perfect storm. In 2016, the CDC, the Centers for Disease Control, reported that construction as an industry was number 2 in the rate of deaths, over 4 times the national average. So 53.5 per 100,000 workers. And that sounds like bad news, but the good news is that suicide is preventable. And what we are learning is if we make suicide prevention and mental health awareness part of a safety culture, we can drive supervisory behaviors, we can change perceptions, and we can provide resources for employees. So this is a very important workplace issue. The significance of suicide is that there are approximately 117 deaths by suicide per day. It is the 10th leading cause of death for all ages. But for the group that is most vulnerable, the men in the middle, it's the 2nd leading cause of death. And that's for men between 25 and 54. And sadly, suicide is largely that male-dominated issue. 78% are by men, and 51% of those are for guns. So this leads us to look at issues relating to restricting access to lethal means. It's the survivors that are impacted by suicide, and it makes this a workplace issue, but also a concern for our families, our schools, and our communities. So everyone has a role to play in suicide prevention. What can be done is to make this part of a safety and health program. Integrate this with wellness, health, employee benefits, and other workplace strategies. Most construction companies have a zero injury program. We're advocating that they also adopt a zero suicide program. My company, we're using a book called Safety 24/7. It personalizes safety and health, and it drives safety not only at work, but at home and in our play. My employees are largely seasonal, and so they have a lot of time away from work where we're not with them. We want to show the same personal responsibility for their safety and well-being and drive crew accountability to look out for one another. So Safety 24/7 is not enough to get employees home safe at the end of a shift. For employees that are at risk, it's just as important or more important to get them back to work safe from home. And this book is helping us drive that level of awareness. So in 2014, the Action Alliance Workplace Task Force began working on the construction industry blueprint for suicide prevention in the workplace. It's a great tool, it's a great strategy, and it provides a building block for a company new to this topic on what can they do for their workforce. I signed on to develop a media strategy, and we've made this topic very popular. We're going to share some resources later in the program beyond this blueprint that will help your companies drive awareness. So despite my long background and history with suicide prevention, I lost a dear friend to suicide in 2015, and I missed many warning signs. None of what I've been doing has been driven by guilt. It's been driven by a mission to save lives. It ties to my mission in the construction world of saving lives and reducing injuries. And the biggest warning sign I missed, I thought if Jeff was talking about his family, faith, and fishing, not always in that order, that he was okay. He wasn't. He masked it very well. Jeff and men like him could have used screening tools like you're going to learn about today to help him recognize that he needed more help than he'd already sought. And so while Jeff's death certificate may say he died by suicide, what I learned is that his true killer was stigma. It was the silence and him suffering in silence, not wanting to talk and burden people, and it was shame of others to not know what more they could do. So what we have been building in the construction industry is an awareness, a toolkit, and resources to show people how suicide can be preventable. This 5-step plan is what we use. We break the silence by talking about it. There have now been over 40 articles in the past 18 months. Dave, James, Bob, and I have written many of those articles. We build sensitivity to reduce the stigma. We provide support. And now we're training supervisors and owners of companies to further the commitment to making workplaces suicide-free. But most of all, it's the upstream issue of integrating mental health and suicide prevention into wellness and employee programs, that is the most effective intervention. And that allows us to build that caring culture and cast a safety net to protect all employees who may be at risk, including their families. So there are two resources I want to highlight if you're looking for a place to begin. One is 10 action steps that companies can take to save lives. It was done by the Construction Financial Management Association and it was written by Dr. Sally Spencer Thomas. And the second is 10 questions leaders must ask, and it shows why suicide prevention is an industry imperative. And Jill, the last topic I want to highlight is what the Construction Financial Management Association has done to help us drive this advocacy, awareness, and accountability in our industry. You'll see this multimedia slide. It shows an article. It shows one of those cover stories. It shows 4 powerful posters that have been developed, largely at the help of Dave James. But you'll also see that logo, the Construction Industry Alliance for Suicide Prevention. You'll see a website right below it, www.cfma.org/suicide prevention. CFMA has recruited over 20 other organizations to help promote this topic in the construction industry. And one of our next initiatives is going to be screening tools like Dave James will share with us in the remainder of this webinar. Thank you very much for this opportunity, Jill.
Thank you, Cal. Please welcome David James, Chief Financial Officer for FNF Construction, one of the nation's top heavy highway contractors. David oversees the company's finance, human resources, benefits, and information technology departments. David brings more than 34 years of financial experience to FNF and the construction industry and is a certified public accountant and certified construction industry financial professional. David is active in the local and national Construction Financial Management Association, as well as committee involvement in other industry associations such as AGC, ARPA, and ATRA. He is a member of the American Institute of Certified Public Accountants, the Arizona Society of CPAs, and Valley Leadership. In 2016, David was appointed to the National Action Alliance for Suicide Prevention and serves on the construction committee within this group. He has been active within FNF, CFMA, and other industry associations in bringing to the forefront the issue of suicide prevention in the construction industry. David?
Thanks, Jill. Appreciate the introduction. My hope is that those attending the webinar will have 2 takeaways from my segment of today's presentation. First, that you and your companies will realize that anyone can be a catalyst of change to introducing this issue into your companies. And secondly, that you'll see how a fellow contractor has implemented cultural changes to support mental wellness among our employees. As I've discussed mental wellness and suicide prevention with my industry peers, they often ask, why would you, the CFO, be that interested and be a change agent within your company on such a topic? Well, for me, the answer was pretty simple. My role as CFO in the company is to protect and preserve dollars. And certainly this issue, similar to workman's comp, general liability claims, and the like, have dollar impacts on our company. This in addition to obviously the human factor that comes along with these activities and issues. Additionally, the CFO is often a player in setting the strategic direction of the company. And this issue is certainly a component to the strategic direction of our company now. Mental wellness, like safety, demands a cultural shift. Lastly, the CFO often is a link to multiple operational elements of the construction company. We have the ear of the execs. We connect with the field and safety on a regular basis, and often it's our responsibility to oversee human resource department as well. And these are all critical elements in effectively addressing suicide prevention in our company. Bottom line is that anyone in your company can take on this issue head to head. Even the CFO can do that. So let's address where your companies can begin. As an industry, we always talk about getting out ahead of problems in order to make a project successful. We talk to our guys about the importance of planning, utilizing company resources all to make their projects more successful. Suicide prevention and mental wellness is really no different. We need to get out ahead of the problem. We need to develop a plan and offer resources to assist in the effort. Initially, we need to engage the right team. The leadership team of the company is key, as with any significant change or issue within your company. Additionally, at F&F, we brought several other champions into the mix. Safety seemed to be a natural, as they have the connectivity with the field. They're out there among the field population, and they're active with the guys on the projects. HR as well, as they are key in developing and communicating company programs that support our employees. A natural champion within your company might also be an employee with a story. Someone willing to share their story of dealing with a loss or personal struggle can be really a very powerful tool. But no matter who the person is, you just need to get started with a dialogue. With prevention as our mantra, that's a great place to begin with your companies. Integration with your safety programs is natural, and if you're a union company, most unions are very supportive of this initiative. We have for years been, as an industry, promoting zero accidents. Cal mentioned this as well, and now that it's time, we need to be sure that we're also promoting zero suicides. It fits in quite well. We need to encourage our company's social networks to support one another and be on the alert for warning signs of employees that are in crisis. We need to educate our people on the facts. Most people are shocked when they hear the facts of our industry's suicide rates. We need to offer the resources and communicate them so folks can actually use them. Also, screening for mental health can be very effective. Our industry screens for a boatload of things. We do pre-hire screening here, we have driver screening, we have drug and alcohol screening, among others. So we need to make sure that mental health screenings are added to that component. They're an effective way to address this issue and as a prevention technique. Since we're talking prevention here, we need to make sure we're looking for the warning signs, the early warning signs, and that's what screening is all about. So very quickly, here's some things that F&S has done over the last year. Training. Our safety and HR directors both went to a full-day training session on suicide prevention so that they could better understand and address the issue with our employees. We have posters up in the office as well as in the field trailers to raise awareness and provide resource information to our employees. We do newsletters every 2 months, and each of these are containing articles on mental wellness. This newsletter actually goes out not only to employees, but it goes out to a lot of our industry partners as well, and has been very effective in spreading the word about this issue. We do weekly wellness e-blasts from our HR folks to the employees, and we've started including information on this issue and the resources that are available. We also offer an EAP, Employee Assistance Program. My main note here is that not all EAPs are created equal, so you need to make sure you do an interview with the EAP proposer and the provider and just find out what services they provide, how they interact, and how proactive they are with an employee that's in crisis. And for personal crisis management, we also offer an ID protection and legal program that minimizes those stressors that can lead to a family crisis. Lastly, we've integrated our wellness program with this initiative, offering as part of our wellness program healthy workshops, so kind of lunch and learns, and a health coach, and incorporated that as part of our wellness program. And these are all, the concept is all to bring up the issue, to talk it up, and to release a little bit of the stress that people have in their daily lives. Now, I've included a couple quotes on the next couple slides from some of our safety, one of our safety directors and a senior project manager as we've introduced the topic. They send a message of connection with employees, trust, the awkwardness of this discussion, and the importance of sending a message of help and hope. So the one up on your slide is from our safety director, The next slide, the next two slides are from one of the project managers that's been involved with this issue with F&F. So we can go ahead and move on to the next two slides. I'll let you guys just read them here real quick because it just, again, expresses the feelings and some of the discussions that have taken place out in the field that a year ago never would have happened. And with that, I will turn it back over to Jill.
All right, thank you, David. I am thrilled to introduce Dr. Jody Jacobson Fry, an associate professor at the University of Maryland School of Social Work. Dr. Fry chairs the Employee Assistance Program, Subspecialization, and the Financial Social Work Initiative. Her MSW and PhD degrees were earned from the University of Maryland. Her research focuses on workplace behavioral health, including the impact of employee health and well-being on productivity and safety. She studies the effectiveness of employee assistance, work-life services, and financial capability programs for working families and has dedicated a significant portion of her research agenda to the prevention of suicide and crisis response in the workplace. She is the immediate past chair of Subcommittee on Workplace Disaster Preparedness and Response for the Employee Assistant Professionals Association. In 2006, she was the recipient of the EAPA President's Award for Excellence, recognizing her work on this committee. Prior to teaching, she provided EAP and work-life services to NASA Goddard Space Flight Center, where she was recognized for several awards for her service to employees and family members immediately following the U.S. terrorist attacks on 9/11. She resides in Baltimore, Maryland with her husband and two sons. Dr. Fry is the principal investigator and is leading the parallel research study evaluating the online mental health programs used in the Healthy Men Michigan campaign, which she will explain to you briefly in the next slides.
Hello, everybody, and thank you so much for taking time from your busy day today to join us on this important webinar. I'm honored to be speaking amongst the esteemed colleagues that have shared their stories and ways that organizations can get involved. And I'm excited to talk with you a little bit about a research project called Healthy Men Michigan as a potential way for individuals and organizations to really become active and get involved in helping to reduce suicide among middle-aged men. So I just want to thank again our partners and funders at the CDC for their generosity in funding this project as well as the embedded research question. And our project today, Healthy Men Michigan, focuses on trying to reduce suicide rates among middle-aged men ages 35 to 64, where suicide in the U.S. is the 5th leading cause of death, which has increased almost 30% since 2000. Most of the programs on suicide actually focus on youth and older adults. It's rare that we see programs and research focused on middle-aged men, middle-aged adults, and specifically not men. And the report, actually on the slide before, from the Suicide Prevention Research Center, is a great resource to look at in thinking about what are some ways we can get involved to deal with this public health crisis. And two things from the report I want to point out that set the stage for this project are that without targeted interventions to engage men in assessment and mental health treatment, suicide will continue to increase among men in their middle years. Suicide will continue to compromise a significant proportion of the U.S. population, and reducing the overall suicide rate in the U.S. requires making substantial reduction in the suicide rate amongst men ages 35 to 64. And those are quotes from this Men in the Middle Years report that I highly recommend. Next slide. So our project focuses on Michigan, and some of the reasons for that, when the CDC issued a grant in 2014, part of my role being on the National Action Alliance for Suicide Prevention Workplace Task Force was to reach out to partners, some of whom you've heard on this call, to see how we might put our heads together and develop innovative response to suicide that also had a research component. And Michigan has remained committed to reducing suicide amongst youth and adults throughout the state, and several partners throughout Michigan were ready to work with us should we be awarded this grant to really focus on reaching out to men in all areas, all parts of a very large and diverse state to try to reduce suicide where suicide among men in the middle years in Michigan is the leading cause of injury death. And what we know about suicide and men and depression, which is part of what our project is focusing on, is that even when depression, which is a risk factor for suicide, is detected, a lot of times men are still reluctant to seek help. And sometimes that has to do with stigma, as you heard Cal talk about with his colleague who died by suicide. There's also threats of being negatively labeled when accessing services, co-occurring issues such as alcohol abuse and other substance use, and oftentimes a general lack of knowledge about that treatment is available, that there are supportive services, and how to access some of these resources. Next slide, please. So to date, this is really one of the first studies that we're excited to tell you about, Healthy Men Michigan, that is evaluating a comprehensive program of online screening for mental health with male-focused interventions directed specifically to reduce suicide ideation and behavior among men. We're merging the best practices from two organizations that you may or may not be familiar with. I'll introduce them momentarily, to look at ways that online screening and referrals can help men to increase their help-seeking behavior, as well as to lead to greater use of online and community referral resources, and to help to reduce depression and suicide ideation and behaviors. We're really viewing this as a public health initiative, which is a little bit different than how suicide has potentially been viewed before. So viewing suicide as a form of violence allows us to really take a public health comprehensive approach to reducing suicide, and gives us the idea of we need to take comprehensive solutions, that this is a multifaceted problem, and so therefore we need to connect to the community. We need to reach out to men where they are whenever they're ready to seek help. Next slide. So the first partner that we are working with is Screening for Mental Health, that hosted this webinar for us today. And some of you may be most familiar with their work on National Depression Screening Day. Screening for Mental Health is an example of an online program that connects people in need in the general public, as well as the workplace, to quality treatment options offered throughout their community. Their flagship program, the National Depression Screening Day, has been around since 1991, and they screen over 500,000 people each year on depression. They do have other screenings and resources available online, but some of the benefits to screening we know are that they offer a feeling of privacy and confidentiality. They're available anytime, 24/7, whenever somebody is wanting to seek help, and they're accessible on multiple devices, offering ranges of validated screening tools, and they're able to link back to resources that we're able to vet and have some control that we know people who are in need of additional assessment or support will be able to get that. Next slide, please. So one of the innovative features of this project is to merge some of the National Depression Screening Day best practices of screening for mental health with man therapy, which you may or may not be familiar with. And man therapy is a resource that was developed out of Colorado that was designed specifically for men who may be at risk for suicide and are generally less likely to engage in help-seeking behavior. So at the center of the project, as you see on the screen now, is Dr. Rich Mahogany, a fictional therapist who encourages men to take a self-assessment for depression, suicide, but also addresses related issues such as anger, substance use, and anxiety. Men are then encouraged to review manly mental health tips, to explore man therapies, and to view videos of men who have lived experience and hope and resilience. And so man therapy takes a humorous approach to trying to engage and educate men about their mental health and suicide risk. Next slide. So our Healthy Men Michigan project that hopefully I think some of you have been on our webinars before, so you're already familiar with, was founded on Mass Men, which is a Massachusetts-based program going on that also combines some best practices of screening for mental health and man therapy, but doesn't have the research piece that we've now built in to the project we're talking about today. Next slide. So the Healthy Men Michigan website, this is our research page where you can see we'll be collecting We'll be offering the screening and also recruiting men into our study through August 31st of 2018. So for those of you that have been on our webinar before, that's a little bit extended, an update with our date to offer some more time to really reach out and get a comprehensive view and opportunity for men throughout the state to not only take the screening, but also potentially enroll in the study. So the screening is open to anybody. Even women, anyone can take the screening. But the research study that's built in is voluntary. And so for men who are in our age group and score on their screening at risk for depression and or suicide, they're invited to be part of a voluntary research study that then has some mechanisms built in to expose them potentially to man therapy as an additional resource and see, does this additive resource of having man therapy really help to reduce suicide ideation and behavior. And men who decide not to participate in the study still get full access to their feedback on the screening scores and all referral resources that you'll see some of them on our website that are offered throughout Michigan. So if there are questions about the research itself, because we're really focusing on building campaign partners to promote Healthy Men Michigan, I'm always available. There's some links on the website to contact me specifically about the study. And just as a little update snippet before I turn it back over to Jill, we did launch the campaign at the end of September of 2016, and since then we've screened almost 600 people. So word is definitely getting out there. I've been on a couple media outlets, and we've done a lot of online promotion through Facebook and Twitter and some of the other resources you'll see momentarily. But the biggest way that we're seeing men are finding out about Healthy Men Michigan overwhelmingly is word of mouth. And so it's so important that our organizational partners continue to promote Healthy Men Michigan, because that builds trust and rapport, and it really encourages men to go somewhere they haven't been before, to take a screening that maybe they've never thought about doing, as a way to reach in and hopefully encourage help when that's needed. So we're excited to have this research study and the broader platform. For anyone that might be at the American Association of Suicidology Conference in Phoenix later in April, I'll be presenting a little bit about the Healthy Men Michigan campaign with two of our partners on Saturday, April 29th, I think. So hope to see some of you there and to chat with you offline about this project. I'll turn it back over to Jill to talk more about the campaign.
Thank you, Dr. Jacobson Fry. I am Jill Fontaine, the Program Manager for Community Response and Contracts at Screening for Mental Health. At Screening for Mental Health, my team and I are responsible for the day-to-day campaign implementation, including outreach and community engagement, promotional partner recruitment, and campaign promotion. Welcome to the Healthy Men Michigan campaign homepage at healthymenmichigan.org. The campaign launched on September 26, 2016. As you can see from the homepage, there is a brief description of the campaign and the opportunity to take a screening. Once users have completed the screening, they will be given resources based on their geographic area. Users who fit the criteria for the research study are able to opt in at the end of the screening. Our outreach strategy was to engage organizations, institutions, groups, and individuals to help get the word out. We organized our outreach efforts into 4 groups with natural overlaps, which consisted of approximately 1,050 organizations and groups. These included behavioral health and suicide prevention organizations and groups, education, public safety, and faith-based organizations, including fire and law enforcement, first responders, health centers, and clubs. Also, business, social, and recreational groups, including the Chamber of Commerce, barbershops, boat, yacht, gun, and hunting clubs, casinos, and sports organizations. Our final group was male-dominated organizations and industries, including veterans and military, construction, first responders, corrections, transportation, unions, law enforcement, and emergency services. We reached out to behavioral health and suicide prevention organizations and groups first, so that we could engage them as referral resources as well as promotional partners. The campaign engaged over 60 behavioral health and suicide prevention resources and promotional partners throughout the state of Michigan. They are listed on the resources page of the Healthy Men Michigan site. We had the most success with the mental health groups, suicide prevention coalitions, and chambers of commerce in terms of partnership. We sent snail mail, conducted outreach calls, and then sent follow-up emails with materials. In February, we hosted a webinar targeted to veteran provider organizations and the veteran community. In March, we'll be outreaching to the construction industry as we are now, continuing our efforts, and then in April, first responders, primary care providers, and then in May, following up with state departments, unions, including corrections and transportation. We currently have 103 partner organizations or groups and a total of 163 individual partners. The promotional toolkit seen here contains everything you need to tell the world about Healthy Men Michigan, such as sample social media posts, social media images, and more. It is your one-stop shop for promoting the campaign. You can order in-person materials to help promote the campaign as well. We have posters, coasters, flyers, and wallet cards. You can visit the online shop and order these materials free of charge. The Downloadable Resource Center is an additional tool you can use for promotion. It contains a press release that you can customize, as well as flyers and other promotional materials. We ask that you fill out the follow-up email survey so that we know how you're going to use the materials and we can track the effectiveness of each outreach strategy. Once you complete the survey, we will provide you with the login information for the DRC or Downloadable Resource Center. Here is a great example of Healthy Men Michigan outreach. Barb Smith, founder and facilitator of the Saginaw Survivors of Suicide and partner on the Healthy Men Michigan campaign, sent us this photo of her outreach efforts. You can also spread the word about the campaign by liking us on Facebook, following us on Twitter, emailing, or visiting the healthymenmichigan.org page. I am now honored to introduce Bob Vanpool, Director of Pine Rest Christian Mental Health Services Employee Assistance Program. Bob helps business leaders leverage behavioral health expertise to enhance the health and productivity of their work teams. Active as a keynote speaker and author, his areas of particular interest include suicide prevention, leading mission-driven organizations and teams, and facilitating individual and organizational resilience after tragedies. Bob is a member of the Workplace Task Force of the National Action Alliance for Suicide Prevention. Bob?
Thank you, Jill. So you've heard some huge numbers. How do you get your arms around 43,000 deaths? You've heard big financial numbers that seem remote. You've heard experts from Seattle, from Baltimore, from Arizona, from Massachusetts, and all of that can make it seem very remote, and then it becomes personal. So the million-mile smile, million-dollar smile on a young man belongs to a youngster named Anthony. I knew Anthony most of his life. His brother was my son's best friend. I coached his sister in Little League softball in the days when the biggest challenge was getting all the ponytails to stick out of the hole in the back of the helmet. And I knew Anthony forever. The last words Anthony said to me were, "Mr. Vander Pol, you're awesome. You're ugly, but you're awesome." And that was the epitome of Anthony. The lovely young lady pictured with him is my daughter. Anthony's grandfather was a local construction executive. It became very, very personal. And every single one of those 43,000 deaths in 2015 was personal for somebody. Next slide, please. I work for Pine Rest Christian Mental Health Services, which is one of the largest inpatient psychiatric hospitals in the country, with a continuum of services that includes the nation's largest fully owned outpatient network of clinics. We deal with suicide every single day, every single hour of every single day. If you just do the math, which you guys are supposed to be good at, and you think about that, admission criterion to get into a hospital is typically imminent danger of self-harm. You can see how many people we deal with every day based upon 7,913 admissions last year. We're also involved on an outpatient basis many times a day, and not all of those sessions are focused on suicide prevention, but many of them are. We're engaged also in providing resources such as training, resource distribution through social media and groups and classes. Please note the URL there, lots of resources available. And then through Through our EAP, we're also engaged frequently with workplaces providing post-pension services for those who survived the suicide death of a colleague. I did that last Friday, and unfortunately it's a very frequent occurrence. So we're very honored to provide a local resource to you here in Michigan through our clinics, whether it's face-to-face, through teletherapy, whether it's through classes, training, social media, whatever it might be. I'm very eager and proud to announce also, next slide please, that we're partnering with CFMA, with Screening for Mental Health, with CAL, with some other organizations as well, to provide a CFMA Suicide Prevention Summit on Pine Rest campus. It will be held on the morning of April 25, 2017, which is next month, and we hope you're there. It's a free summit, and we'll have speakers from Sea to Shining Sea coming in to talk about what you can do to protect lives in your organization as well. So hope to meet you there. Jill, I'm going to turn it back to you.
Thank you very much. I want to thank the panelists Cal Beyer, David James, Dr. Jody Jacobson Fry, and Bob Vander Pol for sharing their lived experiences, personal and workplace suicide prevention efforts, research study, and for partnering with us on this webinar to get the word out about Healthy Men Michigan to the construction communities. As Bob mentioned, Screening for Mental Health will be attending the CFMA Summit to engage with partners and promote Healthy Men Michigan. We will also be presenting on the campaign at the Michigan Suicide Prevention Community Technical Assistance Meeting in Roscommon in May, and look forward to connecting with many of our existing partners there. Thank you all for joining us today. Please take a moment to fill out the feedback survey after this webinar is complete. Your input will help us craft our future webinars and outreach events. If you have questions for any of our panelists, there will be a place in this feedback survey to ask those questions individually, which will be passed on to the appropriate individual in groups. We will also be sending you a follow-up email shortly, including access to a recording of this webinar and information on how to get involved with the Healthy Men Michigan campaign and promotional efforts. Please promote healthymenmichigan.org to your communities and networks. Thank you very much.